Hi, my name is Marypaige Taylor.
And I'm Hannah Moon.
And today we're going to tell you about the IDEA category of intellectual disabilities.
7% of students under IDEA have intellectual disabilities. It originates before the age of 18, and many students have an IQ score lower than 70. Many students with intellectual disabilities have limitations in learning, daily living skills, problem solving, conceptual skills, social skills, and practical skills.
The biomedical factors include genetic or chromosomal abnormalities and malnutrition. Social factors include poverty and undesirable living conditions. Behavioral factors include maternal substance abuse and child abuse and neglect. Educational factors include parents not having supports for limited cognitive abilities.
Up next, we will be summarizing research with intellectual disabilities and music therapy. A university in New Zealand attempted to create an inclusive class on campus with those with and without disabilities. They offered a class called Music for All that was run by board-certified music therapists. While the students enrolled in the class were mainly students with disabilities rather than the split class they wanted, they found that the class helped the students with disabilities become comfortable on the college campus and gave them importance through being enrolled in higher education. The future course hopes to include more students without disabilities and help the students become more comfortable with the greater campus community. Researchers in Ireland did a study with 32 children with intellectual disabilities. They were split into two groups, music and non-music. They ran a pre- and post-social skills test and found that there were increases in social skills in both groups. For this study, they used pre-recorded music rather than live music, which is a limitation of this study. The goals included increasing turn-taking, imitation, vocalizations, initiation, and eye contact. Music was more effective in increasing imitation, which in the session involved rhythmic shaking that helped affect stimulation and coordination. The sounds helped to provide corrective and motivational feedback for the child.
In a case study experiment in Australia, 4 young people between the ages of 10 and 15 diagnosed with intellectual disability of a similar level received music therapy and regular toy play over a 12-week study. These participants also have a dual diagnosis of epilepsy and/or cerebral palsy. The study included 2 30-minute sessions per week. The first 6 weeks were spent assessing and building rapport with the group and individuals. Then there were 3 weeks of individual non-musical toy play and 3 weeks of individual music therapy. Based on the IPCA, responsiveness and social convention were significantly higher in music therapy. In a study done in North Carolina, 32 children with an intellectual disability participated in short-term or long-term music therapy. The interventions done were based on the Voices Together program, which is designed to encourage communication and social behavior. The 2 groups were chosen based on a balance of minimally verbal to conversational speech. The 3 songs used were Hello, Feelings, and Topic, each with different communication goals. Staff rated behavior using specialized code and an adapted Likert scale for each domain. Overall, there was an increase in response during all songs in both groups, but more of this increase was significant in the long-term group. The behavioral approach to music therapy is most commonly used with this population because this approach utilizes operant techniques to strengthen appropriate behaviors and decrease the amount of inappropriate behaviors.
Instructional practices from the Division of Early Childhood include recognizing each child's strengths, preferences, and interests for active engagement. Embed instructions across relevant routines, activities, and environments. Give explicit feedback and communicate consequences to the child. Another instructional practice from the DEC includes using peer-mediated interventions for skill improvement and learning. Through peer networks, children with intellectual disabilities can have opportunities to interact with peers that can be initiated outside of instructional time. The term mental retardation, feeble-minded, idiot, and mentally deficient used to be used within federal laws. Since 2010, the term used in federal laws has been officially changed to intellectual disability. This terminology helps to promote dignity and respect for the individual.
For more information, please visit thearc.org, bestbuddies.org, and aaidd.org.
We hope you learned more about intellectual disabilities.
Thanks for watching!